Hello everyone, today we have a lecturer PAYAL GAHLOT. She having total 17 years of experience in academic, and today's agenda of the interview is about the thought of educations, right? So let's beginning with the interview. My first question is to you, ma'am. When you came to the S.B.B. College of Physiotherapy, what was your vision and how you are trying to achieve the same?
Good morning, everyone. So, when I joined S.B.B. College in 2005, I was a freshly passed out student from another university. My vision at that time was whatever I had learned from my college and my university, from my teachers, I wanted to apply to all the patients that I had heard of, that there were a number of different patients that were present in this college. But slowly, the vision got even more broader. Rather than only applying what I had learned, there was too much of learning on my personal front also, because of lot of expertised teachers which were already there in the department, and I was fortunate enough to learn a lot from all the teachers themselves. From the very beginning, my interest was in the field of women's health, and this was a very great opportunity for me to have joined S.B.B., where I could be exposed to patients who had problems in the field of women's health. It was a very fortunate opportunity for me to get a job here in this college, because I was always aiming to study here as a UG student, which I couldn't, but I was fortunate enough to get a job here. So the vision kept on getting broader, and I was working very hard to achieve all the vision that I had in my mind.
Okay, great, ma'am. So my next question is to you. Being the faculty of community rehab department, what are your roles and responsibility toward the students?
So in the community health department here, we work into major two different departments, that is the geriatrics and the women's health. Both of these departments are not well touched in the field of physiotherapy. So my aim was to broaden the vision of all the physiotherapists across the country and across the state as well, to know what is the importance of physiotherapy in both these fields. We are again fortunate enough that S.B.B. College has two departments, that is, one is the community rehab department, and we also have many patients being referred from the gynec departments. There are various problems related to the gynecology conditions, that is prolapse of the uterus, incontinence, antenatal, postnatal, that is during the pregnancy. So there are vast problems which are untouched, and women don't approach for these problems. So my vision was always to work in this field. I am also a certified pelvic floor rehab therapist. So working in this field and actually making the patient realize that there is physiotherapy for these problems, which are also not being told by the patients themselves, even to their family members at home. So again, S.B.B. gives an opportunity for the staff as well as the students to see these patients, assess them, and work, evaluate them, and give them good rehabilitation program, and achieve all the problems that they have come across.
Okay, ma'am. Great, ma'am. So my next question is to you. What are the best practice offered by the department to the students which help them to gain the necessary skills?
So again, if I talk about the overall OPD as well as the community rehab department, we have a set of assessment that all the students have to take for the patients. And after doing the assessment of the patients, these students, they approach to the staff, and we see the evaluation of the patients that the student has taken, and we rectify whatever mistakes they have done, and give them a lot of clinical teaching on the assessment part as well as the management part. In different fields, we have orthopedic, neurology, pediatric, cardiopulmonary. We have a separate electrotherapy department where there are different machineries which are also there in the department where the patients are being treated. We have a geriatric department, women's health department. So all the different conditions have a different set of assessment program. So all the students undergo this, and they are very well clinically taught from the expert teachers in each department.
Okay, ma'am. Great thoughts, ma'am. So my last question is to you. Do you have any extra activities, curriculum, programs to enhance the skills of the students or expose them to the real world challenges?
So yes, so I believe this saying that all the time study makes Jack a dull boy. So along with studies, we have a lot of extracurricular activities also in the college. Every year we celebrate days celebration, wherein the students themselves, they decide on 1 week or 10 days program on the day celebration, where we have talent competition, we have cultural events, we have different sports activities, we have color coded activities, and along with that, once or two times in a year, we also have a major cultural program which is on a very bigger scale, which is done where all the students participate and showcase their talents. Other curricular activities are also, we organize quiz competitions, debate competitions in the college, which can be inter class wise also and inter college wise also. And students are also encouraged to take part in the programs which are organized by the state or the nation, that is conferences where they can go and present paper or poster, which is also taken as an extracurricular activity. They also take part in various cultural events which are also organized during these conferences. So S.B.B. has S.B.B. is we can say that it is playing its role in all the activities, not only studies but extracurricular also, which includes cultural as well as sports.
Okay, ma'am. So I would like to conclude the interview. So thank you so much for the all information. It is very helpful for the all student and the parents. Thank you so much, ma'am.
Thank you so much.